So the patient has, could you sit up and look to the gentleman, please? She has quite a well-defined part here, but it starts to go down. She's very skinny, okay? She has a laxity. Could you smile, please? And she has this wrinkling on her lateral part of the cheek. She's quite asymmetric, which is totally normal. And I thought she would profit on a well-defined OG curve here and would love to give her a bit of a lateral lift. Could you smile again, please? The wrinkling here is quite strong, so this is why I would love, please lay back, would like to give her some smoothing out of this wrinkled part on her lateral cheek. So, okay, let's give you some GPS, some guidelines on how I do it. The lateral orbit, the line which descends is here. And where this line meets the mid-mentum cone of the mouth line is the highest point. She has this highest point. Can you see that? This point is her highest point, and I wouldn't go for volume here. So what I will do now, this would be the second injection point, okay? What I will do now is, just turn your head, thank you. Define the zygoma, which is very easy in her, and start from here with the zygomatic arch entry point. And I brought some canvas I love to work with. These are 25, 1.5 inch, and in a small face, or in many of typical Caucasian faces, this length is totally enough. I can manage to give her volume in on this area with just one entry point. Did you disinfect the face? Is the face disinfected? Sorry? What I do in order to be kind is I give a local anesthetic blab on the entry point. Ouch now. Ouch. Sorry. Okay, so the first thing is I do tunnel my way. This is a 23 gauge sharp needle. First trick is to tunnel the way. I will go later with my cannula and make this entry hole. One thing, in order to be in semi-sterile conditions here, always never touch the cannula. This can cause biofilm. I always put some protection here. Okay. Okay. Second step is prep the cannula. Never inject air. Okay. Then I hold the cannula as a screw inserted. This cannula has a hub marking. It's in TSK1, so it has a hub marking. And when I turn the hub down, I know that the tip, the hole at the tip is deep, facing down. Okay, because I want to go for a supraperostal treatment. Zoom out a bit, please. Thank you. What I do, no, zoom in more. We want to see more. Okay, perfect. Then next trick is pinch, where you want to go deep, and then advance the cannula. Next step is to control the tip of the cannula. It's here. And now I do place pleural volume, and I stay where I am in order to give her a little bolus here on the periosteum. And you will see the product coming up? Don't be hectic. It's a very well moldable product. You can simply mold it away. Okay, so let's do the first thread now. It's a 0.2 milliliter thread approximately. Are you well, Florence? All fine? And while withdrawing the cannula, I do place the material with a very slight pressure on the plunger. Next thread, always pinch to ease up the cannula going down, but never stress, never push, never be rigorous. If there is no real good way to go, it's the retaining ligaments or any other resistance. Respect this and withdraw and redo your way. And what she needs actually, and this is where I now go, imagine this line, the alar, oops, where's the tragus? Alar tragus line. I told you go deep here, but what she needs, and I can reach that with this length of a cannula as well, is this more superficial placement, which will act as a little stimulating kind of therapy. And I do give her, from the same injection point, entry point, a little support on the subdermal plane. This is how I adapt the therapies. If I see a patient needs anything else, I change my strategy, but I never change the basic strategy, which is giving her a lateral lift here, might be a little bolus here for the frontal projection, okay? This is a bit swollen due to the local anesthetic bleb I gave. Nothing to be worried about. Okay. So let's continue with, could you smile please? With treating this area to smooth out these lines. If you fill these lines directly, you will end up with either having lumps, or if you use a very soft material, you will have, a result for just 3 weeks. So now that's for you gentlemen, that's the subdermal placement. Now it's a very superficial one. I will never give volume in this plane in a, for example, bolus-wise way. Now I have a resistance. I go back, take back the needle, and tunnel the way again. Tunnel the way, that's the word. Now it's easy. Now I'm on the right plane. As she has very thin structures, be careful. This is the very superficial subdermal placement. See the difference to the placement in the upper part of the cheek, okay? That's what we want to have this cracking through the skin in order to stimulate. It's not a stimulating filler, don't take me wrong. This is a technique which can be done with these stimulating fillers in a very nice way as well, but it can be done with an HA as well. That's, you see the subcision, it does crack down the very superficial subdermal fibers. Okay. We could go, that's what we could do later on with the Pluryal and try to fill those lines. Let's see. What about timing? Okay, now the second approach is on the highest point here, a little bolus down on the bone. Need some more material. What's the timing, please? So 20 minutes, okay. So I think I need to finish the other side first, and then we can do fancy stuff. Okay, this is the bolus on the bone, gunshot-wise. This material lifts up very precisely and nicely, see that? And then you can go and mold it. I use creams, and as I have this great ones here, it's the day cream of the Pluryal range. I'm happy to use this one. And I never send patients out without sunscreen, so. She wanted a very natural look, not a puffy or very much changed one. What I do now, because she still needs some volume, is I will give her a little, do you see this depression here? I will give her, let's try the same entry point with a sharp needle, a linear fan, threading fan, just in subdermal plane, in order to give a bit of a volume here. Could you sit up, please, and look to the camera? Can you zoom in, please? And can you smile for us, please, Laurence? Do you see how these lines did fade? And it looks quite, and smile again, please. Okay, and lay back, please. Okay. I will do the other side now, and I'm happy to answer questions. Chantal, est-ce que vous pouvez m'aider, s'il vous plaît? Just hold this, please. Thank you. It's very kind. Thanks a lot. And then you can hold this. Thanks. I'm simply quicker if there's another hand. Thank you so much. I need, now let's see. No, I need the blue one again, please. Do a disinfection on your hands, please. Thank you. Okay. Tip of the cannon pointing down, control the tip, and do a little bolus. Stay where you are, and withdraw the cannon. Just place it somewhere there. Thank you very much. So I used one syringe on her left side, and I will use, I think, another one on her right side, so 1 ml. Okay. Are there any questions in the audience? Can you smile, please? So the entry point for this treatment here to place the material in a subdermal plane depends on the length of the cannula and where the wrinkles are, okay? So in this case, I think I can manage from here. Can you just hold it? Wear gloves, please, and hold it. I need it again, please. Wear gloves. Put it in. Yeah. Ça va, Florence? C'est pas trop prenant? Okay, I can't pass here, so I stretch the skin approximately, and then I can go. Do you see that? This is how I do it. Always respect these resistances. Never go vigorously through. I'd need a 27 gauge, please. A needle. Okay. This side is far easier to inject. Okay. Do you want to see the nasolabial fold with the cannula? I will do it on the right side. I need, sorry, the 25, the blue one. Is it this one? No, this one, the needle. The needle there, the 25. Yeah, 20. Thank you. No, this is a small one. Where's the blue one? This one here. Okay. Ouch. Is that okay? Without, please. I'm simply quicker, you know? Okay. Never inject this. This is a no-go. Doesn't work with any filler. It will always end up in the lateral part, and then it's giving you a bulky look on the modulus. So this is the right placement of the cannula on the nasolabial fold, just subdermal, placing Pluryal volume here. I press on the plunger in a very moderate way and do put always direction medial. Remember what I told, don't put it here, but go medial. You can even go with this cannula if she'd need that, would need that, to the white of the lip in order to blend this out. So that was the second syringe. Okay, that looks good. Can you take that, please? Thank you. I'll always look from upside down. Let my patient smile. Could you do that for me? Okay, that looks quite good. And now you could sit up for me, please, and look to the camera. The objective was to show a blending out, more accentuation of the OG curve here, and give her some, through a indirect approach, softening of the wrinkles on her cheeks, on the lower part. Okay. Lay back, please. What's the timing? Do I still have some minutes? Okay. So what I could show you now is, please lay back. Is the Pluryal. Where is it? Can you open that for me, please? The Pluryal is the first in row. It's a very easy to handle product. It's for lips, lip volume, for wrinkles, for eyebrow lifting, so the first in row. I will fill some lines here. Thank you. I was just wondering whether I could show for the gentleman the jawline, but she doesn't really need it. Not that good as a subject. For line filling, you need to go to the line, needle it up, at 45 degrees, and then go very superficial to the line, and then placement in a very gentle way. Can you see how the line fades? This is thanks to this nice and soft product. You can't do that with all the fillers. I think the biphasic ones are less forgiving. Can you see the needle shining through? This is the right placement. Sometimes you can see a blanch. This is how you can kind of soften out little wrinkles. You have to tell your patients that this is a delicate treatment. It could bruise a bit. As more the skin is sun damaged, the less forgiving it is for these treatments. So that's the way we can deal with wrinkles with this Pluryal range. You can easily mold it out. I always use cream for that. And what I always do as well is to check with my 2 fingers, index and thumb. Could you open your mouth, please? And then I go over the area and just check manually. And then I do change my gloves because this finger is contaminated. Okay, can you press down for me, please? Thank you. Thanks. Okay, we'll do that on the other side. Needle up the wrinkle and place the filler to the wrinkle. You have to make multiple injection points. This is again why in a aging or an aged skin, this will be a bit showing a bit more of side effects, such as little bruises. Ouch. But not in you, Florence. C'est très bien. Il n'y a qu'une petite tache ici. See how precisely this filler is placeable? That's not always the case in different products. Do you have any questions? Mike, for the lady, please.
Thank you for your speech. I was a bit late for the first part of your speech. Hello. Could you use this product just under the eyes, please?
Yes. You know what I do under the eyes? I always mix, and press down here, please, mix with local anesthetic.
Mm-hmm.
So this is my way I can use many different products in that delicate area without having really, what's the question, really problems. The under the eye area, the tear trough, is the most non-forgiving area. I didn't dare to treat for years. The way I do it, I place it deep down on the bone.
You are working by cannula?
Yes,
Yes.
I love to work with the kind of choose the lowest point where the tear trough stops, go in, and then right along the orbital rim, place the filler very deep. Mix with 20 to 30% of local aesthetics.
Thank you.
That's the way I do.
Thank you. Thank you.
We used two types of fillers, the Pluryal volume for the cheeks for the lifting and recurving, and the Pluryal, so the Pluryal for these little lines here. Mhm.
Then which type of gauge we used? Which type of gauge?
It was the 27 gauge
yeah.
for the lines,
For the
and
lines.
the 25 1.5-inch cannula for the
25.
Mhm.
Thank you.
So you can fine-tune these fillers as you like it. As softer you want to have it, use the lidocaine mixing, and as stronger they should be, stay with how they are manufactured. But that's an off-label. That's an off-label. That's a doctor's authority to do that. They don't have lidocaine. That for me that's no problem because you mean that lidocaine doesn't make sense? You absolutely. The gentleman says that lidocaine doesn't make sense in fillers because
Usually in the superficial filler that you did the last time with the Pluryal, it will be the pressure, doctor, on the treated surface will be very, very beneficial, I think. We usually do pressure instead of making just massage. Thank you.
Thanks for that comment. I totally agree. Any other comments?